Everybody, it's great to be here. Chris, thanks for your hospitality and opportunity to just make a few comments. When I think of PATH, I think of MSEPA, and when you reflect on some of the great trends that we're seeing in some of our sub-Saharan African countries, I think of Zambia. And when you think of Zambia, you think of MSEPA, which is one of your programs. And the output and the work that MSEPA has done in conjunction with the Zambia National Malaria Control team and supporters is just exceptional. And the PMI is one of the partners working in Zambia that's benefited from that high-class investment and work. And that has been replicated and then exchanged throughout a number of countries in sub-Saharan Africa. So the PATH, MSEPA, and then other donor cooperative work has really manifested itself. And so I think to you and to your board, I think it's important to really reflect back on the significance of the investment and the results. Looking around this room, I see people that have been in the malaria work for years. Charlie sitting in the back. I was introduced to Charlie Gursky a couple of years ago. He's been doing this his entire professional life. And then Mark Grabowski is here, who's worked in public health. These two gents have been in this business for a number of years. And when PMI was envisioned and launched by President Bush, he did it with specific goals, with a focus on Africa, and a huge commitment in cash by the U.S. government. And that was to achieve some Millennium Development Goals in the place where malaria was impacting the people the most, and to achieve certain targets. And if it wasn't for the work that Mark and his colleagues and Charlie and his colleagues have done in terms of identifying proven effective interventions, we would have really not been able to accomplish what's been done with the partners over the last 5 years. Thanks, Ray, for your nice comments. I'd like to pay tribute to Ray. When President Bush launched the President's Malaria Initiative, one of the things he acknowledged was that the U.S. government couldn't do it alone. Needed the private sector, the business sector, and the countries to step up to the plate too. When we did meet 5 years ago, it was clear to me that Ray was an exceptional person. He brought his own leadership skills to the table, but more importantly, he brought a component that the U.S. government wasn't able to do, and that was to mobilize the private sector and build awareness in ways that it hadn't been achieved before. So, Ray, thanks for the nice compliments, but when I look at what has happened through Malaria No More, and also the collaboration with the other major donors and the private sector, and then launching up to accepting the responsibility and the opportunity as the malaria envoy, with springboarding ALMA, which is the African Leaders Against Malaria. Those deliverables have really allowed us to package this whole international malaria fight in a different way that's actually helped us achieve some of these significant results that Chris referred to. The U.S. government's role, while very significant when you look at the amount that we've invested from the Treasury, your tax dollars, to achieve specific goals and targets, has been huge. And when you look at what the U.S. government has donated through the Global Fund and what the Global Fund grants have done with the countries, it's been huge. So with the collaboration of the bank, the Global Fund, or other technical partners, DFID now has stepped up to the plate, and even in these economic times, have committed a figure of 500 million pounds, if I'm not mistaken, towards malaria, along the full spectrum, from research, some of the technical support, and then also bilateral programs. That's huge. So as we look forward and celebrate some of the successes, I think we need to be sobered by the realities of the world that we find ourselves in. Right now, with everybody looking over here left shoulder, most up at that end of the city, to try to figure out what Congress is going to authorize and appropriate for public health, and then malaria specifically. It's going to have a huge impact on the progress. And so as we focus, as the U.S. government and this PMI focuses in on what has been accomplished, what we're really focusing in on now is to try to identify where the successes have been attained, and then how do we preserve and sustain those positive results. Underneath President Obama's global health initiative, where his goal is to integrate, leverage existing best practices in supporting country needs, there is a mechanism there that we can more efficiently work together to achieve positive outcomes and hopefully work towards sustaining and improving some of these wonderful figures that we're seeing coming in from our PEPFAR, our maternal and child health colleagues, NTDs, and malaria. So I'm not pessimistic, but there's a sober dose of reality as we collectively work together on where we are and then where we need to go. So I'm encouraged by Ray's continued involvement at every level. I'm grateful for the partners, and I'm really encouraged that the focus and the commitment that we're seeing at the national level in the countries where we're working. Now looking forward, and this is probably the most important piece, we can do only so much with the current interventions that we have, which are very good. But in order to achieve the Global Malaria Action Plan on eventual elimination of malaria as a health burden, or elimination or eradication, we're going to need new mechanisms, and that's where MMP comes in. And so we are very grateful for what you're doing. We are depending on future products that you all are doing. And while we've been a modest investor, we're interested in continuing to invest and maybe even invest more depending on what we get in from the budget. That's not a promise, but it is a recognition that as you look at the Global Malaria Action Plan, as it currently is published, the role of science, technology, and research is huge as we try to go that final mile, 2 miles, or whatever it is, as we close the gap and eliminate malaria as a public health problem in this world today. So again, as an impromptu couple minutes of remarks, I'm grateful to be here. Look forward to what the other panelists have to say and answer any questions.